Hi, this is Kimberly Dickerson, and today we're going to be speaking on the subject of HIPAA compliance training. I have my own consulting business, it's Healthcare Consulting, LLC, and I have been doing compliance training for the last 10 years. These slides are as current as of today, and as we all know, the government changes on a daily basis, so tomorrow they could change. But let's get into this. So, what is HIPAA? HIPAA was established by the government in Congress in 1996 to help protect the privacy and security of health information. The actual acronym that it stands for is Health Insurance Portability and Accountability Act. But that was the beginning of it. In 2013, there were several updates that happened that actually changed the makeup of HIPAA. So on January 25th of 2013, the Department of Health and Human Services issued their final rule that modifies the HIPAA privacy, security, enforcement, and breach notifications, which are part of the HITECH, and also added in the GINA, which was the Genetic Information Non-Discrimination Act. This actually was intended to help strengthen the privacy and security protection for individuals' health information, including their genetic information. And it also includes now all of those that are in electronic health records, the EMRs, and all of that information. So as you can see, it breaks it down here on the next couple slides. Really are going to break it down on what it prohibits the sale of the PHI. It expands the rights of individuals to have their information now. It makes business associates who are not directly employed by the business, but they are like legal firms, and we'll get into that a little bit later. But they also are now held responsible if there's a breach. All of these updates really came into play in this final rule. And like I said here on the next couple things, you're seeing it. And the adding of the genetic information was huge. So this prohibits any health plans from disclosing genetic information for underwriting purposes. So who does HIPAA apply to? Well, it applies to health plans, and that's your health insurance companies. It applies to clearinghouses or billing companies. It also applies to health care providers, and that includes doctors, hospitals, laboratories, and pharmacies. And now it includes the business associates. So it goes all the way down to them. So a business associate is not a member of the covered entity, so it's not a member of the doctor's office. Some examples of that are consultants, like myself, legal, financial services, if you have an outside management company come in and look at stuff, accreditation agencies that are coming in to do accreditations, it includes them. They have to sign a business associate agreement, which then will hold them accountable in case any of the PHI is breached. So one thing you have to understand is privacy is your responsibility. As the healthcare worker, you are required to protect the privacy and security of the personal health information. So a patient walks in the door to you, they're entrusting that you protect that information. An example, your best friend asks you to look up her father's test results. What do? Well, you know that HIPAA privacy regulations and your own departmental policies and procedures, you do not disclose this information. It's not the individual who's asking for it, it's another person. Unless they've given strict authority that they can have that information, you do not disclose that. So let's talk about what the components are of the HIPAA privacy. We have the HIPAA privacy rule. We have the HIPAA security rule. So in the HIPAA, there are two different components. Under the HIPAA privacy went into effect on April 14th, 2003. It protects the confidentiality of individuals' health data by regulating how PHI is used, to whom it's disclosed, and how and where it is maintained. It basically makes you accountable to knowing that this information is protected. PHI includes information about a person and their physical or mental health. And remember, it includes genetic information as well. It applies to all such information regardless of its form. So it doesn't matter whether it's oral, whether it's written, or whether they've sent it to you in an electronic format. You have to provide reasonable security measures to protect individuals' health information. So one example I'll give you there is a patient might send you an email from their Gmail. You can't control what they send you, but if you respond back to that Gmail, unless you have a secured line, which Gmail is not, then you need to send it in a password protected document. That's reasonable security measures. You send the document, password protect it, and then you send the password in a separate email. Don't password protect a document and send it the password in the same email. So HIPAA protects all information related to an individual's mental health, including demographic and payment information, whether it is given orally, is handwritten, or is available electronically. All of this information is PHI. Keep in mind as you're looking at this, the one thing here is payment information. This still applies if they're over 18. This applies, doesn't matter if they're 19 and they're on their mom and dad's insurance. You still can't share patient information. Even though dad's paying for it with his insurance, you can't have a discussion regarding that information. That's their protected right under HIPAA. So the privacy rule. The intent is to permit important uses of health information while at the same time protecting the privacy of individuals who are seeking health care. It limits the use and disclosure of PHI and establishes individual rights. Allows covered entities to analyze their own needs and implement programs based on their own environment. It requires covered entities to develop processes in which to handle complaints. If a person wants to file a complaint because they feel that their privacy has been violated, then they have to have a way to be able to communicate that. And if they don't come to you, which you want them to, so that you can try to handle those complaints, they will go to Health and Human Services and it will be investigated, as we will see on the next few slides. So a person who communicates to Health and Human Services if they feel like their privacy has been violated, they must file this in writing, whether it's on paper or electronically, because the Health and Human Services has the ability to do it electronically. The complaint will name the person or subject of what it is and how they feel they've been violated. What happens from there, okay, keep in mind that it has to be filed in 180 days from when they became knowledgeable of the breach. If it is a really bad breach, the Health and Human Services will actually probably waive that 180 days. So kind of keep that in mind. You don't want it to be egregious. Anyway, they're going to investigate it. They're going to come, they're going to review, they're going to interview, they may talk to other patients, they may come into your office and talk to everybody in the office. They're going to ask for you to provide written response on how you did this, including if it went down to the business associate. You're going to have to provide all this information to Health and Human Services. Okay, so if they find that there's not, if the investigation of a complaint indicates non-compliance, they're going to reach out and see if we can reach a resolution of the matter by informal means. So, you know, can you come up with a corrective action plan? Can you come up with another agreement here? If the matter is resolved informally by both the covered entity / business associate and the complainant will be informed of this in writing. However, if the matter is not resolved by informal means, the Health and Human Services will provide the covered entity and / business associate an opportunity to submit written evidence of any mitigating factors. The covered entity has 30 days to do that. In the end, if they find that you still were a breach, there could be civil money penalties, which we will look at here in a minute, which can be very big. If there's no violation, they will dismiss it. Again, the whole idea here is you want these complaints to come to you first so that you can kind of mitigate this. You do not want to have to go down this road, because if it becomes a situation where they feel it was egregious, it's going to cost you lots of money. So it came down with what the individual rights were. They have the right of notice. They have the right, individuals have the right to know who has accessed my PHI, why they have accessed it, and on what date. So they have that. They have the right to receive notice of what you're going to use their data for. They have a right to receive an accounting of your disclosures directly, so you have to provide that to them. They have a right to review their record and ask you to amend it if they disagree with a statement in there. They have a right to request restrictions. So individuals who are 18 or older have a right to say who can access their record. If I choose to say that I do not want my mother or my father to access that, they can make that recommendation. And keep in mind that these are federal rights, so there also may be additional rights under your individual state law. You just need to investigate that. So we talked about the civil monetary payments that could be associated with any kind of breach. There are 4 tiers in which the government has these monetary penalties. The first are where there are situations where the covered entity or business associate did not know, and by exercising reasonable diligence would not have known of the violation. This situation, you're sending out patient statements. One statement accidentally got attached to somebody else's. That's a breach, because once it hits the mail, somebody else received patient financial information regarding somebody else. So, but that wasn't done intentionally. There wasn't any willful neglect behind that. It happened. Your corrective action plan to that is that you go retrain those who are processing statements. They keep increasing though, as you will see here, violations due to reasonable cause and not to willful neglect. Violations due to willful neglect and corrected within a certain time period. So you knew you were wrong, you got caught, and you corrected it. Or violations due to willful neglect and that is not corrected. You knew it was wrong, you knew this was happening, and you did nothing. So take a look at this next slide here, where the monetary values increased to in that did not know. That can still be assigned for every person it happens to, $100 to $50,000 for each violation. So that is still significant. They can, depending on how many times it happens, the government can assign $50,000 for each of those. And it increases. Reasonable cause is $1,000 to $50,000. The willful neglect, and you corrected it, each of those violations can be $10,000 to $50,000. Or the ones where you knew it was happening and you did nothing is $50,000 just upright for each one that they identified, up to the 1.5 million. So you can see where this can be very, very detrimental to a company. Okay, so under the privacy rule, it includes administrative requirements. Those administrative requirements require that every covered entity designate a privacy officer. You should know how to contact them. You should have their information posted so that patients can contact them. It also requires that every year your staff go through HIPAA training. You always want to keep training, even if it's the same information, that refresher course. You need to do it every year. You must have safeguards in place to protect their PHI. And there must be a procedure to discipline employees who do not comply with the privacy policies. So everybody needs, when they hire in, they need to sign something that says they understand that if they do not comply with your PHI privacy policies, the PHI policies as far as HIPAA, that there's going to be discipline. And depending on how egregious it is, it could include termination. So now we look at reasonable safeguards must be in place to protect your PHI. That was one of those administrative requirements. So that can be broken down into 3 categories: physical, administrative, and technical. So some examples of physical safeguards: controlling business access with photo identification swipe card systems, locking offices and file cabinets containing PHI, turning computer screens away from the public view, minimizing the amount of PHI on desktops, and shredding unneeded documents that contain the PHI. So then we look at the administrative safeguards here. You've got policies and procedures. You've got staff training programs. You've got to set up an auditing and monitoring compliance with the policies and procedures. If you create policies and procedures, what you need to do, you need to monitor it. You need to audit that. You need to make sure those policies and procedures are working. And if they're not, you need to adjust them, or you need to retrain your staff. Don't just assume you put a policy in place and it works magically. We hope that's the case, but that's not always the case. And you need to have employee confidentiality agreements. As I said, when they sign in, they need to understand that patient PHI, we take it seriously. You don't share any information with anybody else. You follow the PHI requirements. You don't access somebody's file, even if you know them and they're a patient of ours. If there's no reason for you to be in that file, you don't need to be in it. Technical safeguards. And this is kind of one of those situations now as we get into all these different computer systems, you have different security levels, allowing people to be in different places. You have a scheduler at the front desk. Do they really need to be in the patient's chart? They just need to be able to schedule that patient. They don't need to have access to view and read somebody's chart. You need to look at those different security levels. You need to audit again and monitor the ability to track where they've been and see why are they going there. You need to make sure that everybody's computer is set on an automatic log off after a specific time. We would like to tell people that they need to do the Control-Alt-Delete and lock their system every time they get away from their system. That's the most appropriate. Does it always happen? No. So in those instances where something happens to take somebody away from their computer, you want it to shut down. The other is the user authentication with login and passwords. Make sure, this goes without saying, that the passwords aren't stored on a little post-it note to the computer. They need to be in a locked situation. They shouldn't be shared with anybody else. So my password should not be shared with anybody else to help keep these safeguards. So now let's look at fax machines. Fax machines are okay to transmit PHI. They are in compliance with the HIPAA program. However, you just need to minimize the risk of misdirected faxes. And these are just little reminders. If it's a frequently used number, I would pre-program it. If it's not pre-programmed, then always before you hit the button that says send, you double check. Make sure you've typed it in correctly. It's so easy to transpose a number or to accidentally hit the wrong one. And then you always want to make sure that you include a confidentiality statement on the cover page. And it includes that if this has been directed or gotten to the wrong person, please contact us immediately. You need to know that. My information will be shared at the end of this as far as how to get a hold of me. If you don't have a confidentiality statement, email me. I'll get you one. You want to, once it's all gone through, you want to check the confirmation to, again, just to ensure you send it to the right place. Many offices have a lot of people coming in and out of them. You want to make sure you don't leave the original report or PHI information on the fax machine. Nobody else needs to see that. Take it with you. And if you have sent it to the wrong place, you want to make sure you not notify your supervisor or you notify the privacy, the HIPAA person that say, oh, we had a situation happen. You need to make sure you're documenting this and showing what the action is. So if you identify you sent it to the wrong number, you need to figure out whose number that is if possible and call them and say, I need you to shred that, please. You know, if something got attached to what you were sending and it went to the right place, but you accidentally included somebody else's information, that still needs to be reported to your compliance officer, but you also need to contact the end result and have them shred that information. Okay, so notification. All covered entities are required to provide individuals with a notice of privacy practices. So the NPP, as that it's called, is information, and we've all been there in the doctor's office where they said, do you want a copy of our privacy practices? And most of us anymore now say no. but you have to be offered that information. They have to have it posted. A lot of them have it posted now and just says, there's a copy of our privacy information. Take a look at it. Let me know if you have any questions. Most of the time they require that you sign saying you got this or were offered it. This information tells you how they're going to disclose your PHI, what they're going to do with your PHI, how they're going to protect it. This is your right to know how they're going to collect it, how they're going to use it, how they're going to protect it. So remember we talked about that you have a right now to give authorization of who has the authority to see it. There are some areas that are given the ability to transfer that information without having your permission. So those entities are like a billing department. So if you're utilizing an outside billing service, they're going to sign a business associate agreement, but it's going to allow you the ability to transfer that information. Laboratories, if your stuff gets sent out to a laboratory, your PHI is going to be sent with that. If it's regarding treatment, healthcare operations from doctor to doctor, your information will be shared, and we can do that without your written authority. So there are a few different areas that we can go. Again, here's kind of a detail of it quickly. Perform requested tests and treatments, bill for services performed, perform essential operations including quality assessment, accreditation, and compliance, and to meet legal reporting requirements. So if we're required by the state, the public health department to report something, we don't need your authorization to do that. It is automatically given to us. Other than that, these little things here, these 4 situations, it requires authorization from the patient. So you cannot give it to somebody without their authorization. So what do you give them? Well, we want to make sure that we're given the minimum necessary information. Love that word, minimum necessary. But it means that the minimum amount of PHI that they need for their intended purpose. So let's say when releasing information for a lab visit, I'm going to give them the name, a date of birth. Obviously, they're going to have their sex. They're going to have a diagnosis code because they're going to be providing a lab on that, what the lab test is. They don't need to know their other genetic history or anything else for that. They need that minimum information. So just keep that in mind. You want to make sure that you're only given the information that is needed. If an insurance company asks for a data service, medical records, unless the other medical records helps to justify why you did what you did today, then you only send the date that they're requesting. All right, so now we have the business associate agreements. Remember, I told you that you needed to have an agreement that was signed by both parties, that understood what we will release, making sure that both ends are keeping that information private, protecting the PHI, and what is only permitted. So again, some of the situations where you're going to have business associate agreements, claims processing, data analysis, utilization review, billing. Some others are going to be legal, accounting, consulting, management firms. You may have accreditation firms coming in, getting some information, financial services, any subcontractor who creates, receives, maintains, or transmits PHI on your behalf is going to need a business associate agreement. Also, keep in mind that you're going to want, if you have a cleaning crew come in, they need to sign a business associate agreement. They need to understand what HIPAA is. You need to make sure those people have gone through HIPAA training, because in the event that they accidentally see some information on a desk, which they shouldn't, but if they do, then you want to make sure they understand that they need to keep that private and cannot share that information. So make sure if you're bringing in an outside cleaning crew that they have been trained in HIPAA. Put them through your HIPAA training, yearly HIPAA training. Make them sign that they've gone through that they understand the risks, because that risk now comes all the way down to them. Okay. The HITECH Act creates direct liability for uses and disclosures of PHI by business associates that do not comply with this business associate contract. So this is where the HITECH actually directed, clear down that any penalties by a billing company or an accreditation or whatever who shared that information would be taken all the way down to them. Now, that doesn't dismiss that the covered entity is going to get charged for it as well. It's just also going to be all the way down. So let's talk about breaches, because we all hear about breaches every day. You see we see it on the news, you know, people are throwing PHI out in trash. We have the insurance companies, Anthem had a breach, or Walgreens had a breach, and you're seeing these big things. They don't always get to be that big. If you have a breach, you have an ability to self-report any of those. So I recommend doing, you can go out to the HHS, you can self-report. We had a state patient statement, got attached to somebody else. We have our course of action, corrective action plan on that was we retrained our staff. We double check and make sure now I'm putting in those statements. You've given what happened, how many were involved, and what your course of corrective action is. Trust me, those little things come into play in the event you have something big happens. But we all know about those great big things that happen. So if you look at the second bullet here, covered entities are required to notify Health and Human Services immediately of any breach affecting more than 500 individuals. So let's just talk about how easy that is. Somebody's computer, everybody has laptops anymore. That computer gets lost. It wasn't password protected. It has 500 plus individuals' names, date of birth, home addresses, social security numbers on it. That requires an immediate notification to Health and Human Services. And it can't happen any later. And for any other breach affecting fewer than 500, you have 60 days. Okay, but what can happen on that is you're also required, if you have 500, you're required to notify the media. This is why we see it on the news. If you have more than 500 individuals involved in it, you are required to notify the media. You don't want your name out there. I know I don't want mine out there for breaches of that sort. What is de-identified health information? We talked about minimum necessary. If you're sending something and you're looking at what the result of a drug is, so you've given this drug to these many patients, and you're able to pull that we prescribed this drug for these 15 patients, and this is their outcome from it. I don't need to identify who the patient is. I care that I have this many who were prescribed that drug and what their result was and how it either helped them, didn't help them, anything. So we want to use de-identified. De-identified is anonymous. I can't tell by looking at that information who it is. I can have the diagnosis code, the drug that was prescribed, and what the outcome was. That doesn't tell me who it was or who received that. So the privacy regulation details a specific individual information that needs to be removed from PHI for it to be qualified as de-identified. You want to make sure I can't look at that information and know from looking at it that that's Kim Dickerson. And you should use that whenever possible. Emails back and forth to each other, if you can communicate in a chart number instead of a patient's name, nobody's going to know what a chart number is if that accidentally gets sent out. Easier things to go back and forth on. All right, so the HIPAA security rule. Remember we've been talking about the privacy rule. Now we have the security rule. This is actually brought in with the electronic health information. And it defines how you need to protect this. Health records, everybody's going to it now. You have to have access to it. You need to make sure it's safe. So electronic PHI includes PHI in any electronic format. And again, you're looking at its use and disclosure related by the HIPAA security rule. So PHI is stored in computer systems, electronic storage media, servers, workstations, laptops, PDAs, your phones. Everybody's getting their emails on their phone. You better have a password protected on your phone so that somebody can't just pick up your phone and see your emails. In addition to the HIPAA privacy official, you can have a security official. They can be the same person. So if you're a small company, they can be the same person. If it's a large company, they may be two different individuals. You may have a privacy person who serves as your compliance there, but you may have a security officer who's over your IT department. So depending on your size, you may have one or you may have two. And again, just like the privacy rule, you have the three different categories: the administrative, the physical, and the technical. So the administrative safeguards obviously include policies and procedures. You know, you need to have an active review of audits of your IT or IS activity. Employee confidentiality agreements, employee security clearance policies and procedures. You need to make sure you have those disciplinary policies. And what's happening with your data? What is your data backup? Where are you keeping that data backup? How are you protecting that? What happens if you have to hit a disaster recovery plan? Keep all of those things in mind as you're putting your stuff together. Your physical safeguards include, again, where is this stored? So are you limiting access to the facilities? Are you locking doors in your work areas? Are you wearing ID badges at all times? Are you limiting visitor access? Are you limiting access to workstations with ePHI? Again, turning those computer screens away from view. Are you locking up and securing laptops? You know, taking special precautions to secure those workstations in public areas. Again, your phone, everything. Please make sure you have, if you're getting email on it, please make sure that you are putting a password on those phones. You know, you need to take additional safeguards when you're disposing of those materials. You need to make sure you're doing it properly under the guidelines. Where are they going to be destroyed at? How are they going to be destroyed? How are they going to be shredded? Are they going to be able to be completely wiped? So these are all things that security individual needs to take in place before you just put a laptop out to the curb. Because keep in mind that everything's recoverable. So you got to make sure you're cleaning it off appropriately. It's all recoverable until we can't find what we need, right? So technical safeguards obviously refer to the technical policies and procedures, the level of access to the computer systems being controlled, making sure that people have access only to what they need access to. Make sure, look at that log to make sure there's no activity that shouldn't be there. Make sure they're logging off, if possible, when they leave their workstation. That's the easiest point. So somebody else doesn't come in, I have my system up, I haven't logged in, I stepped away to go to the restroom, somebody else walks up and they access an area that I'm not supposed to be in. I'm going to tell you, when they pull that security log, it's going to come on you because your system is logged in under your ID. So you want to make sure that that is logged off. Passwords, they need to be strong. They shouldn't just be like a three-character password. They need to be strong and they need to be changed regularly. It should never be, and we all do it, so we need to make sure we look at this a little differently now. You want to remember to not select that, remember my password. Because somebody sits down on your computer, they go into that document, that program, and you've got it saved, they can just hit, oh, okay, log in, and they're in there seeing that information. We don't necessarily look at it that way, but keep that in mind because somebody could sit down and just access your information immediately in that situation. We want to make sure that if you're a big company, this happens, but if you're a smaller company, make sure you have virus and malware protective software on it. You want to make sure that people aren't having suspicious stuff or opening it. If it looks suspicious, it probably is. There are a lot of people trying to get into systems nowadays, and they're sending emails that look very realistic. If you don't know who it's coming from, you aren't expecting it, and it looks suspicious, I probably wouldn't open it. But you want to make sure you have software that's going to identify that too. They throw it into your junk folder. That's a first thought. Oh, this looks like junk. Keep that in mind. You want to close your pop-up windows at the X rather than the no. So a lot of times they'll put a little bug in the program behind the scenes that if you hit something on the screen, it's automatically starting to download information from your computer. Close it at the X. If you accidentally get into a site you didn't want to be, close it at the X. Don't hit anything in the middle. Okay, email security. We talked about this. If you're sending to a Yahoo, a Gmail, there's no security for PHI that way. On those emails, there's no security. So please make sure you're putting it in a password protected document. Otherwise, a lot of companies will have situations where that's there. Okay, so let's just take a look at a case study here. You're given several sets of logins and passwords to access various information systems. The login is yours. your own first initial and last name, but you are having difficulty remembering the passwords. So you write them down on a sticky note, which you keep at your desk. This is not a good idea because it's actually all of these. Obviously, someone else can look at and see what your password is, so I can get in there. I'm going to guess your facilities procedure, if it's not a procedure, it needs to be that they keep their own logins private. If someone else misuses your password, you're going to be responsible for that information. And you know, if you lose the sticky note and haven't memorized your password, you're no longer have access to those systems. So just keep those things in mind. So that's the end of the presentation. If you have any questions, the next slide here has my contact information on it. Please don't hesitate to reach out to me. I'm here to assist.